and welcome back to the show. Well, throughout the course of the pandemic, pharmacists have played an important role in the management of the COVID-19 issue. Community and special pharmacies will continue to be a focal point of healthcare delivery in various communities all across our nation. Now, there's been a promise of long overdue relief, which has kept afloat independent pharmacies that otherwise would have closed their doors over the last year, but hung on to the commitment to keep their communities healthy even as they began to lose money. Here now to tell us more is the operations manager at Mount Carmel Pharmacy, Javier Maldonado. And Javier, good to have you here on Open.
Thank you for the opportunity. Pleasure to be here with you.
Good to have you. Introduce us to an independent pharmacy. We know about pharmacies. There's Walgreens, there's CVS, but when you talk about an independent pharmacy, how do you define that?
So you look at the independent community pharmacy as that beacon of hope in the communities that they serve. When you look up and down the block, it's in many cases the one professional establishment that individuals can go to. In regards to access to healthcare, pharmacies and pharmacists are quite frankly the most accessible providers in the healthcare system. And when you think of doctors and when you think of going to your clinics and going to the hospitals, you need to have that insurance card in order to actually see a doctor or be seen by a doctor. Otherwise, you have out-of-pocket expenses. When you think of your local community pharmacy, 7 days a week, you're able to go into that pharmacy and receive professional medical counsel. You're able to receive information about the medications you're on. You're able to speak and discuss your conditions, your symptoms with a licensed professional pharmacist. And that access is free to anyone who decides to walk into that door. Very different from any other professional licensed individual.
Yeah. So when you have independent pharmacies, obviously there are some benefits to the community, but being an independent pharmacist, you also have some challenges as well. COVID-19 has definitely impacted everyone, and particularly right in the borough of the Bronx, the hardest hit. But then you as an independent pharmacist, you've also had to deal with some financial struggles. Share with us a little bit about that.
So sure, as the pandemic hit, many independent pharmacies had to reduce hours in its efforts to help maintain social distancing, help, prevent people from being out and about at later hours. And so we had to reduce hours. Obviously, reducing hours prevents the amount of customers and patients that you are able to serve in any given day. As a result of the pandemic, we've also had to increase home delivery. And those are expenses and costs that an independent pharmacy picks up. Those are not expenses that are passed through to an insurance company. Those are not expenses that are picked up by anyone. There is no charge for our delivery service. It is free to our patients and free to the population that we serve. In addition to that, you also have an increase in patients who are looking for better ways to manage their medication, whether it's adherence packaging, whether it's medication synchronization, whether it's MTMs, where we're counseling patients on the medications that they're on. These are all different services that you're able to receive from your community pharmacy at no additional expense. And you take it a step further, not only is it at no additional expense to the individual who's receiving the service, it is an expense to the business owner who's running the business and offering those services. And we offer those services because we've entered this space. We've entered pharmacy, we've entered healthcare to take care of people. And that is what's our primary focus. It's why we keep our doors open every single day. It's why during this pandemic, not one day did Mount Carmel Pharmacy close its doors, because we recognize the responsibility that we have to the public and the community that we serve. Closing our doors it isn't a business decision, or keeping our doors open, is not a business decision. It's a decision based on the public and the community that we serve. Where will our patients get their medication? Where will they get their insulin, pain management? And you think of the list of other services that are offered from the pharmacy that patients rely on to live their daily lives. You close those doors, you close that beacon of hope to the community.
Give me this here, because when we talk about closing doors, it's a possibility for a lot of independent pharmacies, because you guys were looking for possible financial relief from New York State that has not yet occurred. Talk to us about that, the money that you were anticipating to help you to keep the doors open, but still has not yet happened.
Yes, absolutely. I believe, in New York, pharmacists feel deeply betrayed by elected officials in Albany right now, especially when it comes to the Medicaid fee-for-service program, which we were being told to hold on, that it was coming, and lo and behold, it doesn't look like it's coming. And the effect of that is it makes it difficult for a business owner to run their business in an unpredictable revenue model. Currently, the way it stands, we can't forecast budgets for the year. We can't make informed business decisions when we don't know how we're going to be reimbursed, when the predictability of that revenue model is unstable. And what that does is it leads you in a position where how much longer can you continue to keep those doors open? How much longer can you continue to be in the communities that you serve and be of value to those communities if you can't keep those doors open? When you're getting paid pennies, and I mean literally pennies, on prescriptions that you fill, it doesn't even cover the expense of the ingredient. And even if it does cover the expense of the ingredient, it doesn't cover the expense of where that medication is being put into, whether it's a bottle, flask. It doesn't cover the cost of the labels to put on that medication. It doesn't cover the cost of the labor that is involved, the pharmacist who has to review that prescription, check that prescription, the technician who has to count that prescription out, the delivery personnel that has to take that medication to the patient, and all of those pieces that occur behind closed doors, behind the scenes, to get that prescription that is prescribed from that doctor into the pharmacy, filled, and to the ultimate end user, who's that patient who needs the medication. There are many steps that go on before that actually occurs. And when you're not being reimbursed in a manner that can sustain that type of business model, it leaves you questioning whether you can keep those doors open anymore.
Yeah. And real quickly, I know that you've decided to give back to the community in your own kind of way. We got about a minute left. Share a little bit about the give back.
So we've done a lot within our communities with regards to COVID testing, with regards to COVID vaccination. During the height of the pandemic, we were partnered with the local Boys and Girls Club, where we were offering PPE packages to give out to the community and to give out to families who needed it and didn't have the means to get it or the access to get it. So we partnered with local charity organizations such as that to help give back to the communities that we serve. We realized that the only reason we have the business that we have today are for those patients, are for those customers, and are for those individuals who live in the communities that we serve. They give us the opportunity to be of service and to be of value, and we thank them each and every day that we're given that opportunity to serve them.
Javier Maldonado, definitely great to have you on the show. Great work that you guys are doing, and hopefully we can see some good things happen for the people over at Mount Carmel who definitely need it in that community. Thanks a lot, buddy.
Thank you. Pleasure.
All right, now I want to let you know now, if you want more information, we encourage you, go ahead and visit their website at mountcarmelpharmacy.com. Again, mountcarmelpharmacy.com. Now we do have more show. Don't want you to go anywhere. Stay with us. Open will return right after this.